Hello everyone. In this video we will learn about the practical demonstration of vital signs. Theory class already we have discussed in previous video. In next we will learn about how to do the particular vital signs with practical demonstration.
Now I am going to start to take the first vital sign, that is temperature. So here I am using glass thermometer which I have taken from antiseptic solution. After taking from antiseptic solution, wipe the thermometer from bulb to stem in rotation manner. From bulb to stem, like this. From tip to stem. Because it is already dipped into the antiseptic solution. So the tip वाला part है वो solution में था तो वो less contaminated है. After that, hold the thermometer into the mid axillary point. Tell to the patient to put your hand into the chest. It will helpful to hold the thermometer into the axilla. Then start recording, means note the time. In between you can talk with the patient, ask about the health and other things. After 2 to 3 minutes, remove the thermometer gently and again wipe with cotton swab. But in this time, clean the thermometer from stem to bulb in rotation manner. Then read the value. After that, tell to the patient also what is the value or what is the temperature of the patient. Now I am going to perform the procedure of pulse taking. How to take the pulse. So here you can see the hand of the patient. This is thumb, and this thumb is important. Thumb side is important to take the pulse, because pulse is I am going to take the pulse from radial area. Okay, from radial area. But before starting you have to note the time. Use the tip of the index and third finger of your hand to feel the pulse in the radial artery between wrist bone and the tendon on the thumb side of the wrist. Then record for 30 seconds. After 30 seconds, you can multiply in 2. Next procedure is to take the respiration of the patient, to check respiration of the patient. First, put the hand of the patient into the chest. After that, check the time and put your one hand into the hand of the patient. Like this, you can see in this. Then start the checking the respiration, means one breath include इंस्पिरेशन एंड एक्सपिरेशन. आप यहाँ पे देख सकते हो चेस्ट क्या है, एक्सपेंड हो रहा है और फिर नीचे जा रहा है. तो एक बार ऊपर आना और नीचे जाना, इट इज कैलकुलेटेड एज वन रेस्पिरेशन. ओके, अभी अप हुआ और नीचे गया तो दैट इज वन रेस्पिरेशन. चेक फॉर 30 सेकेंड एंड मल्टीप्लाई इन 2. नेक्स्ट प्रोसीजर is taking the blood pressure. Here you can see this is stethoscope. In this part is known as bell. This part is known as chest piece. It is stem. Then this is tubing. This is ear tube. And it is earpiece. It's all about stethoscope. Then sphygmomanometer, manual BP apparatus. It is valve, air valve. It is tubing, cuff. You can see the tube is inserted in midpoint of the cuff. Two tubes are connected here. It is lock, mercury lock. It is scale or manometer, which is useful for the reading of blood pressure. Patient should be seated comfortably with arms supported at heart level. Then snugly wrap the cuff around the upper arm 2 inches above the elbow. 2 inches above the elbow. After that, feel the brachial pulse. Take stethoscope. Place the stethoscope just above the crease of the elbow at brachial point. Then close the valve and start pumping with the help of pump. Pump the cuff to around 180 to 200 mm of Hg. Then slowly open the valve to let the pressure fall. When you first hear the beat of the blood flow, that is systolic pressure, and when you last hear the beat of the blood flow, that is diastolic blood pressure. मैंने यहाँ पे जैसे ही वॉल्व को रिलीज़ किया था तो जो आवाज़ आना स्टार्ट हुई थी वो 140 पे स्टार्ट हुई थी, ठीक है, और उसका जो बीट जो 140 से कंटिन्यू चलते चलते जैसे ही मैंने उसको और नीचे किया तो जो बीट है वो 80 पे स्टॉप हो गई. मीन्स स्टार्टिंग पॉइंट ऑफ द बीट इज अबाउट 140 एंड एंड बीट इज अबाउट 80. सो द BP is 140 by 80 mm of Hg.